welcome to the deep dive. You know, we live in a world that's just saturated with information, right? And when you're going through something huge, like pregnancy, trying to figure out what's actually important, well, it can feel overwhelming. That's really why we're here. We want to cut through that noise and give you the essentials, help you feel genuinely well-informed. So today, we're doing a deep dive into week 13 of pregnancy. And this isn't just, another week on the calendar. It's often seen as a real pivotal moment, a turning point.
Exactly. A turning point for both the person who's pregnant and, of course, for the incredible development happening inside.
People often call it the honeymoon phase of pregnancy, actually. And we're going to explore exactly why it gets that name.
Yeah, and for our guide today, we're leaning heavily on BabyCenter. It's a really well-regarded resource, medically reviewed, trusted by tons of expectant parents.
Right.
It gives you those insights into fetal development, what's changing in your body, practical tips. It's really comprehensive stuff.
So our mission really is to distill all that, pull out the key insights, the facts that might surprise you, the advice you can actually use. We want you to leave this feeling like, okay, I get it now, those aha moments.
Absolutely, because there's so much happening beneath the surface. And importantly, this is often when you start feeling some really noticeable changes. It's where the unseen starts to become, well, tangible.
That seems like the perfect place to start, actually. Because for so many people, maybe the biggest, most welcome change around week 13 is that those really tough first trimester symptoms start to ease off. The really sore breasts, that crushing fatigue where you can barely function.
Debilitating fatigue for some.
Totally. And the food aversions, the morning sickness, which isn't just in the morning, as we know.
Definitely not. All-day sickness is more like it for many.
Right. And needing to pee constantly. Around week 13, for a lot of people, it's like, phew, a bit of a break from all that.
It really is. And, physiologically, there's a really clear reason for that. It boils down to a major hormonal shift. In the very early weeks, this little structure called the corpus luteum. It's in the ovary. It does the heavy lifting, producing progesterone to maintain the pregnancy.
Right.
But by week 13, the placenta is, well, fully formed and ready to go. It takes over as the main hormone factory.
Ah, so it's like a changing of the guard.
Exactly. The placenta takes over, and because it's doing the job now, the hormone levels tend to stabilize. Those wild fluctuations that cause a lot of the nausea and fatigue, they smooth out.
That makes so much sense.
Yeah, it's a really efficient transition. The body just adapts. It's pretty incredible how it fine-tunes everything for the next phase.
So for you listening, this hormonal handover often means, well, relief, like serious relief. It might not be overnight, but many people notice a real surge in energy. You start feeling more like your old self again.
Yeah, that fog lifting is a common description.
Totally. After weeks of feeling maybe pretty rough, that energy boost is just so welcome. You can actually do things again. It feels like, you can finally breathe and maybe even start enjoying being pregnant.
It's like a biological, okay, we've got this moment, the body finds its new rhythm, and it's gearing up for the second trimester, which is typically characterized by more steady growth and often, the most physically comfortable phase for many.
That's great news. But it's not just about relief, is it? There's also some amazing preparation happening kind of behind the scenes.
Oh, absolutely. Things you might not even be aware of yet.
Like, I read that even though breastfeeding seems ages away, the body might already be making colostrum.
That's right, colostrum, often called liquid gold. It's this incredible pre-milk.
Pre-milk, okay.
Yes, super concentrated with nutrients, antibodies, proteins, everything a newborn needs in those very first few days after birth. It's ready and waiting even before your main milk supply establishes itself.
Wow, so the body is planning way ahead.
Months ahead. It's remarkable foresight. It's like building in a safety net. If the baby arrives early, or if milk takes a little while to come in fully, that colostrum's there, providing crucial immunity and nutrition right from the start.
Nature's backup plan.
Pretty much.
Yeah.
It really makes you wonder, doesn't it? How does the body orchestrate all these complex processes so far in advance without any conscious input? It's all geared towards protecting that new life.
It really is astonishing. Now, shifting gears a bit, but still on the theme of preparation, our source, BabyCenter, also mentions that week 13 is actually a pretty good time to start thinking about a baby registry, which might sound early to some, especially if you're just coming out of that first trimester haze.
It might, but it actually makes a lot of sense psychologically.
How so?
Well, starting a registry helps channel that returning energy and growing excitement into something concrete. You're moving out of that early, am I okay? Is the baby okay? Survival mode.
Right, the anxious phase.
Yeah. Get into the more joyful planning stage, thinking about what your baby will actually need, visualizing their arrival. It makes it feel more real. It's part of that nesting instinct kicking in.
Yeah, making it tangible, researching little outfits or cribs.
Exactly. It's a positive way to connect with the reality of the baby coming.
Speaking of reality,
Yeah.
let's talk about what's actually happening inside the womb. Because the progress there is just incredible. Okay, get this, and I found this part kind of mind-blowing. At 13 weeks, the baby can pee.
Yep. They've developed that ability. They're swallowing the amniotic fluid around them.
Okay.
And then their little kidneys process it, and they excrete urine back into the fluid.
No way.
Yes way. And the amazing part is that whole volume of amniotic fluid gets naturally recycled by your body every few hours.
That's incredible. So they're already practicing using their kidneys.
Essentially, yes. It's not just a weird fact. It's vital for the development of their urinary system, making sure the kidneys are maturing and functioning properly. Swallowing also helps the digestive system develop. And as they swallow that fluid, something else starts happening, the formation of meconium.
Meconium.
Yeah.
The first poop, right?
Exactly. It's this sticky, dark, tar-like substance made up of stuff the baby ingested in the womb. Amniotic fluid, old cells, bile, stuff like that. It builds up in their bowels, and typically that's the first bowel movement they'll have after birth.
So even waste management is happening in there.
It is. It shows those internal systems are really gearing up for life on the outside. It's like a dress rehearsal.
It's like a tiny self-sufficient biosphere in there, managing its own fluids, processing waste.
It really is remarkably efficient. The amniotic fluid isn't just padding. It's this dynamic environment the baby is actively interacting with.
It just highlights how sophisticated fetal development is. All these systems preparing for a launch day, so to speak.
Absolutely. And it makes you wonder what other practice sessions are going on that we don't even know about, all designed to get them ready.
Truly makes you think. Okay, so beyond the peeing and the meconium, what about the baby's structure, bones and things like that?
Yeah. Week 13 is huge for structural development, too. The baby's skeleton, which started as cartilage, is really starting to harden now. This process is called ossification.
Ossification.
You see, especially in the longer bones, arms, legs, and also the bones of the skull. They're becoming denser, stronger. These are the foundations for their whole life, supporting movement, protecting organs.
Building the framework.
Exactly. And, believe it or not, tiny tooth buds are forming deep inside their gums. You won't see teeth for months after birth, obviously, but the groundwork is being laid right now.
Amazing. So bones hardening, teeth starting. What else?
Well, here's one that's really unique. Fingerprints.
Fingerprints already.
Already starting to form.
Yeah.
Those intricate swirls and loops on their fingertips, the pattern that will be uniquely theirs forever. It's being etched right now.
That is genuinely incredible at 13 weeks.
Isn't it? Think about the genetic programming involved, that unique identifier forming with such precision so early on. It's like a tiny secret signature being written.
Wow. So while you're maybe just starting to feel better, getting your energy back, this little person inside is developing their own unique identity, right down to their fingerprints.
It's exactly it. So much detailed construction happening that you can't see.
Okay, so with all this development, the peeing, the bones, the fingerprints, how big is the baby now? Give us something to visualize.
Right, the classic fruit analogy. At week 13, your baby is about the size of a plum.
A plum. Okay, I can picture that.
Yeah, roughly 2.6 inches, maybe a little more, from head to rump. That's how they measure them early on, and weighing around 2.5 ounces.
It still sounds tiny, but I guess compared to the weeks before.
Exactly. Think back a blueberry, a raspberry, maybe a lime just recently.
Huh.
So a plum represents quite a leap in size and complexity.
Right.
Don't underestimate that plum. Inside that small package, you've got functioning kidneys, hardening bones, developing teeth, unique fingerprints, intricate systems already working.
Holding a plum takes on a whole new meaning now, doesn't it? A tangible reminder of this little life inside.
It really does. It helps grasp the scale of what's happening.
Okay, so shifting from the baby's world back to yours. Let's talk about some physical things you might be experiencing around week 13. Cramping, for instance. Is that normal?
Yes, occasional cramping can be very normal. Your body's going through huge changes.
So what causes it?
It could be simple things like gas or bloating. Digestion slows down in pregnancy, thanks to hormones, and the growing uterus puts pressure on your intestines, so that's common.
Makes sense.
But a really common one around this time and moving forward is round ligament pain.
Round ligament pain. Okay, what's that?
You have these ligaments, like thick cords, that support your uterus. As the uterus grows bigger and heavier, these ligaments stretch.
Ah, like stretching rubber bands.
Kind of. And that stretching can cause sharp, sudden pains, maybe down one side or both, in your lower belly or groin. Or sometimes it's more of a dull ache.
Okay, so what helps if you get that?
Often simple things work. Changing position slowly, maybe doing some gentle movement like walking. A warm bath or shower can relax the muscles. Sometimes just resting, lying down for a bit, takes the pressure off. Staying hydrated is good too.
But when should you worry? Like, when is cramping not normal?
That's the crucial question. The advice is clear. Call your doctor or midwife immediately if the cramping is severe. If it doesn't ease up after resting for a few minutes, if it's constant, or if it comes with other symptoms.
What kind of symptoms?
Things like bleeding, fever, chills, dizziness, or pain, or unusual tenderness way up high in your abdomen. Those could signal something more serious is going on.
Right. So pay attention, know what's typical stretching versus potential warning signs.
Exactly. Trust your body, but don't hesitate to call if something feels really off. It's always better to check.
Good advice. Okay, another shift. Many people experience appetite, with the morning sickness hopefully fading.
Food might actually sound good again.
Right, which is a massive relief. But then sometimes come the cravings.
Yes, the legendary pregnancy cravings.
Are they real? And why do they happen? Pickles and ice cream, is that a real thing?
Huh. Well, cravings are definitely real.
Mm.
As for why, that's still debated.
Ugh.
One theory is nutritional. Your body needs more something, say iron, so you crave red meat, or needs calcium, so you crave dairy.
Seems logical.
It does sometimes, but then you get cravings for things with basically no nutritional value or really weird combinations.
Like the pickles and ice cream.
Exactly. So many experts think it's more complex. Hormonal shifts can drastically change your sense of taste and smell. Plus, there's a psychological component, comfort foods, maybe cultural associations. It's likely a mix of all those things.
So no single answer.
Probably not. But they are a very real and often very strong part of pregnancy for many. So if you suddenly need chips dipped in chocolate, you're not alone.
Good to know. Okay, what about some less fun symptoms? I read about stuffy noses.
Oh yeah, pregnancy rhinitis. It's surprisingly common, affects maybe up to a third of pregnant people.
Just a stuffy nose out of nowhere.
Pretty much. No cold, no allergies, just congestion. Caused by those hormones again, and also the increased blood volume swelling the nasal passages.
Increased blood volume causes a stuffy nose.
Wow. It affects a lot. That increased blood volume, remember, it's like 30 to 50% more blood circulating.
That's a huge amount.
It is. And it's why you might also start seeing more noticeable veins. Blue veins might pop out more on your chest, breasts, your belly.
Yeah.
And potentially varicose veins in your legs too, because of the volume and the pressure from the growing uterus on the veins in your pelvis.
Okay, so the stuffy nose, the veins, it's all connected to that extra blood doing its job.
Largely, yes. It's your body's amazing circulatory system adapting to support both of you. Annoying symptoms sometimes, but signs of healthy adaptation.
And do they go away? Please tell me if the stuffy nose goes away.
Yes, generally these things resolve pretty quickly after the baby is born. So thankfully, temporary.
Phew. Okay. 2 more common things to touch on. Vaginal discharge and heartburn. Let's start with discharge. More is normal, right?
Yes, totally normal to notice an increase. Higher estrogen levels cause it. It's usually thin, milky white, and odorless or very mild smelling. It's actually protective, helps prevent infections traveling up.
But again, there's normal and not normal.
Exactly. You need to call your provider if the discharge changes significantly. If it becomes gray, yellow, green, if it smells bad or fishy, or if it comes with itching, burning, or pain.
Because that could be an infection.
Could be bacterial vaginosis, a yeast infection, or something else that needs treatment. So paying attention to changes is really important.
Got it. And then heartburn. Ugh, that burning feeling.
Yeah, acid indigestion or reflux, very common, especially as pregnancy progresses, but it can definitely start around now for some.
Why does it happen?
2 main reasons again, hormones and physics. Pregnancy hormones relax muscles all over, including the little valve at the top of your stomach that's supposed to keep acid down.
So the acid escapes upwards.
Exactly. And then as your uterus gets bigger, it physically pushes your stomach upwards, squishing it and forcing acid up into the esophagus. Double whammy.
Ouch. What can you do about it?
Lifestyle things first. Avoid trigger foods, often spicy, fatty, acidic things, sometimes chocolate or caffeine. Eat smaller, more frequent meals instead of big ones. Try not to lie down right after eating.
Makes sense.
Chewing sugar-free gum after meals can help too, boost saliva, which neutralizes acid. If those don't cut it, definitely talk to your doctor or midwife. There are safe over-the-counter and prescription options they can recommend. Don't just suffer through it.
Good point. Manage the symptoms proactively.
Definitely. Finding what works for you can make a big difference to your daily comfort.
Okay, let's pivot to the practical stuff, the 13-week checklist, if you will. What should be on your radar now?
Well, first up is staying on top of your prenatal care. As you move into the second trimester, visits usually become more frequent, typically every 4 weeks.
So expect more appointments.
Yeah. These are really important for monitoring your blood pressure, your weight gain, listening to the baby's heartbeat, measuring your uterine growth, all that good stuff.
Keeping track of everything.
Exactly. And it's also a good time to become more aware of potential complications, things like gestational diabetes or preeclampsia.
Even though the doctor's checking for them.
Yes, because you knowing the warning signs adds another layer of safety. Things like sudden swelling, severe headaches, vision changes. Being aware empowers you to flag things up early if needed. It's about being an active partner in your care.
Right, not just a passive patient.
Precisely. These appointments are your chance to ask questions, build that relationship with your provider, and feel confident about how things are progressing.
Good advice. What else is on the checklist?
Nutrition. It was important before. It's arguably even more important now with all the rapid growth happening.
Even if nausea is still kind of hanging around.
Yeah. Do the best you can. Focus on nutrient-dense foods when you can eat, healthy snacks, superfoods, things packed with vitamins and minerals.
What are the key nutrients now?
You definitely need good amounts of protein for building tissues, healthy fats especially for brain development. Folic acid is still crucial. Iron needs go way up to support that increased blood volume. Calcium is vital for the baby's bones and teeth, and to protect your own bone stores.
Wow, lots to think about.
It is, but think quality over quantity. Every healthy choice helps build that baby and keep you strong. It really is foundational for long-term health for both of you.
Making those good choices count. Okay, what about comfort and well-being?
Big one. Sleep position.
Yeah.
Experts really recommend sleeping on your side, especially as your belly grows. Left side is often touted as ideal, but either side is better than your back.
Why is side sleeping so important?
It's all about blood flow. Lying on your back can put the weight of your uterus on major blood vessels, especially the vena cava, which returns blood to your heart. Compressing that can reduce blood flow back to your heart and therefore potentially reduce flow to the baby.
Ah, okay, so side sleeping maximizes that flow.
Exactly. More oxygen, more nutrients getting to the baby. Plus, it helps prevent swelling, varicose veins, even hemorrhoids for you. It just works better with your changing anatomy.
What if you're not naturally a side sleeper?
Pregnancy pillows. Seriously, they can be lifesavers. They provide support for your belly, back, hips, knees, whatever you need to get comfortable on your side. Worth investigating if you're struggling.
Good tip. Invest in sleep. Okay, next point on well-being. Sex. Is it safe? Does libido come back?
Good questions. For most people, yes, sex during pregnancy is perfectly safe. And yes, often libido does make a comeback in the second trimester. That first trimester exhaustion and nausea isn't great for feeling frisky.
Sure.
As energy returns, desire often does too. And interestingly, some women find sex more pleasurable during pregnancy because of all the increased blood flow to the pelvic area.
Oh, interesting. But is the baby... Okay, people worry about that.
Understandably. But yes, the baby is extremely well protected. They're cushioned by the amniotic fluid, surrounded by the strong uterine muscles, and the cervix is sealed by the mucus plug. Unless your doctor has specifically advised against it for a medical reason, like preterm labor risk or certain placenta issues, it's generally fine.
Good to have that reassurance, so if you feel like it, go for it.
Pretty much. Communication with your partner is key, of course, as your body changes, but there's usually no physical reason to abstain.
Okay. Last checklist item. Maternity clothes. The bump is starting to show. Do you need a whole new wardrobe?
Not necessarily a whole new one, and definitely not one that costs a fortune. Your regular clothes might start feeling tight around now, but there are smart ways to manage.
Like what? Belly bands.
Belly bands can extend the life of your regular pants for a while, but eventually you'll likely want some actual maternity wear for comfort. The good news is you don't have to buy everything brand new.
Secondhand.
Exactly. Online resale sites are amazing for maternity clothes. People only wear them for a short time, so you can find great stuff in excellent condition. Consignment shops, thrift stores too.
And swap groups.
Yes. Look on social media or local parent groups. Clothing swaps are fantastic. Trade things you don't need anymore for things you do. It's sustainable, saves money, builds community, win, win, win.
Smart. Be comfortable without breaking the bank.
That's the goal. Embrace the bump stylishly and affordably.
So, as we get towards the end of this deep dive on week 13, let's talk about that bump. It's becoming real now.
It really is. End of week 13 means you're officially over a third of the way through. That's a huge milestone.
Yeah.
And physically, the top of your uterus is now high enough to rise out of the pelvis. That's why you, or others, might start noticing a definite little bump.
It's moving from a secret, to something visible.
Exactly. It shifts the experience. It can feel really exciting, maybe a bit strange at first, but it makes the pregnancy undeniable. It often invites connection with others, too.
A visible sign of the amazing journey happening. It feels like a real turning point, like we said at the start.
It truly does. More energy, feeling more yourself, and seeing that physical evidence of the life growing inside. It sets the stage for the next phase beautifully.
And all the information we've talked about today, largely from BabyCenter, it's just one piece of the puzzle, right? There's so much support out there.
Absolutely. Resources like BabyCenter cover the whole journey, from trying to conceive through every week of pregnancy, postpartum, baby care, toddlerhood, name generators, health guides, community forums.
It's a whole ecosystem.
It really is. It highlights that pregnancy is just the start. These resources are there to support you through all the stages of parenthood. You're not meant to figure it all out alone.
That's a comforting thought. There's help and information available every step of the way.
Definitely. Knowledge is power, and community support is invaluable on this journey.
So wrapping up our look at week 13, we've covered the welcome relief as those early symptoms often fade, the incredible developments inside peeing, fingerprints, bones hardening, and the practical steps you can take for your own comfort, health, and preparation.
It's a week packed with milestones, both the ones you feel and the ones happening silently inside. It really does mark that transition into the often smoother sailing of the second trimester.
So here's a final thought to leave you with. As your body starts showing these outward signs of change, and your baby continues its incredible, intricate development, think about this. How are the experiences of these first 13 weeks, the patience you've needed, the ways your body has adapted, maybe learning to trust the process? How is all that preparing you, not just for the rest of pregnancy, but for the whole huge, amazing, challenging journey of parenthood that's coming? What inner preparations are happening alongside the physical ones?
Keep listening to your body, keep learning, keep asking questions. The journey is ongoing.
We really hope this deep dive gave you some valuable insights and maybe helped you feel even more connected to what's happening right now. Thanks for joining us. Until next time, keep learning, keep growing, and really embrace the wonder of it all.